Ladies and gentlemen, welcome. When we were here yesterday, I don't think any of us thought that we would be back so promptly. The fact that we are moving with speed shows A, the seriousness of the situation, and B, just how well the system is working. Now, unusually, I'm going to be reading from something rather than just speaking without notes. 4 positive cases have been identified overnight which are not travellers, and it is not clear yet if they are linked. We must, for the moment, assume that this is a result of community seeding. Dr. Brink will discuss this more, but what we know is as follows. We are announcing a lockdown with immediate effect, and I stress that, a lockdown with immediate effect. We're telling the community to stay at home. The good thing is, unlike before, this is not new to us. We've done this once already. We know as a community that together we can do this successfully and keep each other safe. People should stay at home unless they're either seeking medical care, carrying out essential shopping for food or supplies, or for up to 2 hours exercise each day outdoors. You should only be with the people from your own household. The sole exception to that is where somebody lives on their own, and therefore it is allowed in those cases for the person to take their 2 hours exercise with one other person from another household, but again socially distanced. In terms of leaving your home for medical care, that makes sense, and you should do that. That does not mean that you should just go out unless you have good cause. If you have a COVID vaccination appointment booked and you feel well, you should attend. And I emphasise that, you should attend your COVID vaccination appointment if you feel well. The Community Vaccination Centre at Beausejour will open as anticipated on Monday, and if you have an appointment, please be there. Those who chose the centre showed great prescience because in the case of community seeding, it was anticipated it would still be suitable, and it will be suitable. And again, I emphasise again, please, if you do feel well, please keep your COVID vaccination appointment. With regard to work, if you can work at home, you must do so. Those who cannot work at home should only work if they are essential or key workers. We will be publishing lists of those today. These are very similar to those from the initial lockdown in the spring. Restaurants and non-essential retail are not being treated as essential and should not open even for deliveries or takeaways, but we'll review that in the coming days. Schools will also close except for those who are the children of key workers or are children from vulnerable families. I'll just repeat that. Schools will close except for children of key workers or for children from vulnerable families. Even in doing this for the second time, we know that the rules are not perfect. This is not about perfection, it's about speed and communication. We also know that a lockdown is not easy. Guidance to support services is also available on our website. Call your friends, call family, use video links, stay in touch, communicate with each other. We must remember that the objective here is to prevent the virus spreading. We should remember that in every single action that we do. We know there will be many questions. We're continuing to meet and make decisions. We expect these measures to be in place for some time, but they will be constantly reviewed, and the first review will be in 2 weeks. We will be holding another briefing tomorrow at 12 noon to provide more information. Now I'll pass you over to Dr. Brink.
So thank you very much, Deputy Fairbrush. And as Deputy Fairbrush said, none of us expected to be here today. I thought it'd be useful to start off by telling you about how events unfolded yesterday afternoon. So about 4:30 yesterday afternoon, I got a telephone call from the laboratory saying that they had 4 potential positive cases in the afternoon's COVID testing run. And I went up to the laboratory and reviewed the results with the laboratory manager, who's also a microbiologist. And both of us were concerned about the test in that we really felt that these results looked genuine. On top of that, we were concerned about the absence of a travel history. So this was an unusual situation for us. So the community sampling team went out to the 4 individuals' homes whilst they stayed in self-isolation and resampled, and we retested urgently. We got those results at about 7:15 last night, and they confirmed as being positive. We then initiated a contact tracing process, and through the evening into about 1 o'clock this morning, we did the initial contact tracing. And it was apparent to us that none of the 4 individuals had travel history, nor did anyone have links to a case or contact with a traveller. So these really do appear to us to be unexplained community seeding at the first sight. Now, of course, as we carry on doing our contact tracing processes, we might find a link to the cases, but at the moment, we cannot find an apparent link to those 4 cases. So clearly, from a point of view of management, our initial focus was on the clinical management of the 4 cases. There are 3 adults and there's 1 teenager, so really important. And all of them are at home and being managed at home. However, what we want to do now is look at not only the close contacts of those 4 cases, and that contact tracing process is ongoing as I speak, but also because we've developed an enhanced testing capacity, we will do far broader testing. Now, if I remind you what we did in October last year, when we had that small cluster, we used our enhanced testing capacity to throw the net widely and see what we had around the cases. So as such, what we're also going to do is that the one person had an association with the Ship and Crown and the Crow's Nest. So we're asking everyone who was in the Ship and Crown or Crow's Nest between the 18th of January and the 20th of January to contact us, but not by phone, through our email. So we're asking them to email testresults@gov.gg and give us their details and their contact details, so we'll then be able to call them in for a test. What we also are doing, and this is, we will be personally we're contacting the parents of year 8 in one of the schools on the island, and we'll be asking all of those children to be tested together with the teachers of those children. That'll give us a first idea of what is going on. We'll be going to some other retail outlets and doing some more targeted testing, and we're doing very detailed testing on household contacts of those cases. So this will carry on through the weekend, and we're expecting to do hundreds of tests over the weekend. And this is indeed what we developed our enhanced testing capacity for. Now, the other thing I want to emphasize is whilst we're in a phase of uncertainty with potential community seeding, I would also ask islanders to come forward if they have symptoms suggestive of COVID-19 and get a test. Really important that we do that so we can identify any other cases of community seeding. Now, what Deputy Fairbrush said is we want to go into lockdown, but we want to go into a short, hard lockdown and try and suppress the virus completely. And as ever, we go back onto the evidence. So the sequential progression through the processes will depend on the life cycle of the virus. So as you all know, the 2 to 14 days, so we'll go in 7 and 14-day increments, and we'll be updating you on a regular basis with regard to that. Now, I think from our point of view is we also wanted to say thank you very much to the community once again for working with us. We've always worked together on these matters, and I think it's really important that we continue to work together. And I've no doubt if we work together, we'll hopefully progress through as rapidly as possible. I just want to bring 2 other measures to the fore that Deputy Fairbrush spoke about some of the measures. So there are a number of other measures. I'd like to remind everyone about social distancing. So 2 meters social distancing, hand hygiene, respiratory etiquette, and we're strongly advocating the wearing of masks as well. So all of that, as we've always said, there's no one measure that's going to get us out of it. We're going to use our test, trace and isolate, but we're also going to use our non-pharmaceutical interventions, so our social distancing, our mask wearing and our hand hygiene. So thank you very much, and thank you for your support, and I'll hand back to Deputy Fairbrush.
Thank you very much, Dr. Brink. And just to emphasise, social distancing, cleanliness, all the things that happened before, and indeed wearing masks, we really do advocate that. It's not being made compulsory at the moment, but it's strong advice that people wear masks. But really, it's the opportunity for ladies and gentlemen in the press to ask questions. And as I say, the idea is to communicate as much as possible, as quickly as possible, and it is a fast-changing situation. Yes?
Do you have any idea which strain of the virus we're dealing with? Is it the new variant?
So we can't answer that without detailed genetic fingerprinting of the virus. There's always a concern that this could be the new variant, particularly as it's come up so rapidly. So we don't know. We will be sending the samples for further sequencing. That isn't something we do on Ireland. So we do the diagnostic testing on Ireland, but actually looking at the sequence, the genetic fingerprint of the virus, we don't do on Ireland. But we will be sending those samples to see if they're the variant, if they're the same or different. So it will give us a better idea of what's going on.
Can I ask a supplementary? Do you know how long that's likely to take?
It varies because it's out of our hands, so it depends on how overwhelmed the UK laboratory is. So unlike here, where I can say to you exactly the timings I'd expect, with regard to sending samples, it's not in our gift to determine how long that's going to take. So I'm sorry, I can't provide you with a precise answer on that.
Thank you for the question, though. Yes.
Ewan Duncan from BBC Guernsey. Dr. Brink, how closely have you looked at what the Isle of Man did recently when they got cases and the lockdown procedures they went through?
Yeah. So I speak to the Director of Public Health regularly at the Isle of Man. She and I have worked closely together throughout the pandemic, and I found having a relationship and discussing things with her is extremely useful. Now, the Isle of Man went into a short, sharp circuit breaker, and in fact, many of the things that we're proposing, the structure we're proposing, is very similar, and something that Dr. Hewitt and I have discussed on a number of occasions. So, yes, it is a similar process to what they followed, and as you probably know, is that they're starting to step away from it now, and their lockdown has been very effective.
Yeah, and they're just coming out of lockdown now.
Yes.
Are you happy with what you've seen from their data, what they've done, that this will be a similarly successful model?
I think we can't control for all the variables because we don't know. Our situation might be slightly different from their situation. So, but the principles that they used, I think, are absolutely sound, and we agree with them entirely.
Deputy
I
Salisbury.
understand we've seen around the world where people don't have strict lockdowns and make sure that we stop everything, that it doesn't, and things can get quickly out of control. We've always had a cautious approach here, looking at what best suits Guernsey, and in this instance, this is the best thing that we believe, and it's in the best interests of the community, and that was discussed at the CCA this morning, that this is the best approach to take.
Paul.
Can I just add also on the events so far today, I think the community will understand that we put out a very early notice, having met between 6 o'clock and 7 o'clock this morning, without the regulations being worked on, but we must acknowledge the community for the immediate response they had to that public announcement early this morning. And special thanks must go to our retailers who started to put on social distancing requirements. And we also know that many of you had large community events. Some events were actually due to take part here today in Beausejour were cancelled, which is very disappointing for everybody. But we must acknowledge how quickly you as a community have seized this and the importance of it. But would also say that please be patient with people such as our retailers as they start to put back in place the restrictions and the social distancing requirements that we were aware of and used last year.
Yes.
Just to check my understanding correctly, so we've got our 4 individuals and they're from 4 separate households?
Yes, indeed they
And
are.
were they symptomatic or asymptomatic and picked up through other means?
They were tested because they were symptomatic. So I think you're aware that we've always had a very proactive symptomatic testing program, and one of the reasons why we have this program is so that we're able to pick up cases. So I think if you recall in the first wave, we broadened our testing criteria much earlier than a lot of other jurisdictions, and we've continued with proactive testing. I think I've shown you some slides in some of the press briefings, and so they were tested because they were symptomatic, and so we tested them for COVID-19. Interestingly, none of them had the typical symptoms of loss of sense of smell and taste. So it just shows how we've got to be careful and cast that net quite wide with regard to respiratory symptoms.
Yes, sir.
Yeah, can I, just for complete clarity, is it definitely going to be a lockdown for 2 weeks? There's no opportunity for any restrictions to be lifted in that time at all?
No, it's not a lockdown for 2 weeks. It's an indeterminate lockdown. It'll be reviewed in 2 weeks. It'll be periodically reviewed. But there will be, as we said, for example, the takeaways can't open. But that will be reviewed in the next few days to see if, again, using 2 for examples, if in a week's time there can be takeaways. There'll be considerations. Deputy Dudley Owen, who's been very ably came in this morning, very promptly came in, should be making statements in due course about educational matters, about schools. I've dealt with the fact that schools will not be open. They're closed now, except for vulnerable children and children of key workers, etc., etc. But no, it will be a lockdown of indeterminate length. That doesn't mean forever, because we wanted to get us back as quickly as we can in relation to the community. But the first review is intended to be in a fortnight's time. Do you want to add anything, Dr. Green?
No, I think that's absolutely correct.
Thank you.
Ewan Duncan from BBC Guernsey again. Can I just ask about the bubbles? I know that you'd mentioned it, but just for clarity, again, it's no bubbles. It's just stick within your household if you can.
Yeah, bubbles came in last time. It was at a later stage as we were moving out of lockdown. And so, yeah, nothing to worry about right this moment.
Yes, and then you. Sorry, you first.
Just checking about the other islands. Obviously, is travel between Guernsey and Alderney and Sark going to be restricted now to try and protect them from us?
Well, Sark have said they're having a meeting, or they were going to have a meeting at 11 o'clock, because we finished our CCA meeting about 10 to 11, I can't remember the exact time. And Senator John Gill said that it was the intent in Sark that they would only operate, except to get people backwards and forwards that are currently in Guernsey or Sark, as the case may be, and need to move. They would only be moving cargo from presumably after today. I don't think John actually specified that. Also, in relation to Alderney, traffic will be restricted as much as possible, but again, there has to be some movement between the 2 islands. But the idea is, the general, whether anywhere in the bailiwick, the idea is that you travel as little as possible. There will clearly be some people that still have to go to work, essential workers at hospital, etc., or care workers. They still have to go to their place of work. But we keep travel as minimum as we can, and the restrictions are meant to be, sadly, stringent. But the idea is, as Deputy Salisbury said, a sharp, or as short as is possible, sharp lockdown, so that we can come out of it as quickly as we can. Because we want people to be, we're so grateful, as Paul has said, we're so grateful for the response we've had in the last few hours, because people aren't silly. They know that something's coming, and they've reacted so positively.
Thank you. Rosie Allsop, Island FM. This has obviously come as quite a shock for the community. Do you have any messages of comfort and reassurance for people who might be understandably feeling quite worried and anxious right now?
Absolutely, absolutely. I said in my little introduction that people should contact. There is a site they can contact and speak to friends, speak to everybody, because of course people will be anxious. And the idea is that they shouldn't be. This isn't a crisis, it's just a severe situation that needs addressing. There's no need to panic, there's no need to be depressed about it, but it's better to do something now, as Deputy Salisbury has said, than let it linger, and it will undoubtedly be worse.
I think the messaging we've had in public health today is a feeling of reassurance that we identified it. I mean, we were only aware of this at 4:30 yesterday afternoon. And so it's under 24 hours for us getting the test, confirming the result, doing the initial contact tracing analysis, the CCA meeting, making decisions. So it's under 24 hours that all of that's happened. And I think that's actually been reassuring to the community that we are here 24/7 and we will work as hard as we can to protect the island. And I think that's the messaging we're getting, is that they're reassured that we're acting quickly to protect the well-being of islanders. So we'd like to continue with that message. And I think from Public Health Services, we've just felt that wall of support from islanders, and it's been really encouraging.
Heidi?
Yeah, I'll just say assurance, we're on it. As Nikki said, we're on it. We're working on it. We're in a different place to where we were last year. We've got a plan of action that we never had before. We were literally making up as we were going along, and our best estimates of where we were. We have a plan, and the whole community has done this before and knows what to do. And that feedback I'm getting is, that's fine. We know what to do, and we know this can work, because by working together, it will work. And we've got such a strong community spirit, we will make it work.
There's 3 parties to this. There's a public health, Dr. Brink and her team. There's the politicians, and there's the public. All 3 elements, in my view, have one aim: to get over this as quickly as possible, but to adhere to the rules. Because if we don't, then it'll be prolonged, and it'll cause more dissension and more problems. Yeah, lady first and then the gentleman after.
In terms of, has there been any talks about financial support for businesses that are being forced to shut? I know obviously it's very early, but is this something that's being looked at?
What I would say, if I could answer that, in the first instance, we are behind the scenes looking at all the support structures that we've had in previously to see how those can assist in the coming days. As I think Deputy Fairbrush mentioned in his opener, there will be a follow-on briefing tomorrow at midday for us to be able to put points of clarification. As Dr. Brink has said, this has happened very quickly, so we felt it important for these initial messages, but we will provide further clarification tomorrow.
You and then you, sorry.
Just wanted to ask a quick word about those who might be concerned about getting their vaccination at Beausejour. I know from personal experience, I came up here earlier for the briefing and I was directed away from that entrance. But Dr. Brink, maybe a word on that for anyone who over the coming days might be coming to get the vaccine.
So I think that's a really important question. Thank you for asking it. So Beausejour is empty, so there's nothing else happening except for the vaccination program. And for those of you who have seen the video that we did, is as you come in, it's a large area, there's place for social distancing. All of the chairs are set more than 2 meters apart, so protect people. We chose the Sir John Loveridge Hall because it's so huge and it's got a very high ceiling, so it's almost like being outdoors, so that was really important. It's a one-way system, and in the recovery area, again, it's all socially distanced. All the areas are wipeable, hygienic. The nurses will, or the vaccinators will be wearing some additional protection when they immunise the population, but we really encourage people to come in and get immunised because it's our biggest chance of actually protecting the health and well-being of the most vulnerable in our population. So the other thing is if people do have specific concerns, please do contact us to discuss those concerns, because quite often, and I've taken quite a few phone calls, just a discussion saying, actually it's all socially distanced, it's set out well, have a look at the video clip of it, really is encouraging.
If I could add
Yes, of course,
to
sorry.
that as well. It is absolutely imperative. One of our ways out of lockdown is going to be that we get the majority of our community all vaccinated. And as Dr. Brink said, one of the other things is when you do come to the centre, which is going to be open all next week except for Wednesday, is don't bring more people than you need.
Yes.
Just come on your own if you can. If you do have to have a carer with you, then that's fine. But keep the social distance. And also there will be plenty of parking, so that's one thing that you will have no problem with the next few weeks.
Thank you very much. Yes, sir.
Dr. Brink, I know previously you said that it was much easier to begin the rollout of the vaccine when there wasn't community seeding, so how damaging is this in terms of the speed in which we can roll out the vaccine?
It shouldn't affect the speed of us rolling out the vaccination program, but it's just going to make it more complex. So we're going to have to control entry into the areas. We're going to have to use slightly extra precautions for our vaccinators and so on. But it should not affect the speed of the vaccination program. We really are very, very clear that we want everyone to come and get immunised. But yes, we will be taking extra precautions within the centre. We will be making sure that social distancing is enforced within the centre. So we'll be looking at all of those. So it makes it more complex, but it should not affect the speed of the rollout because we're so well established. And that's one of the reasons why we chose the centre we chose. And I know it was, some people, perhaps weren't so pleased with that, but we chose that because we knew that we'd be able to continue rolling out the programme in such a centre in a safe way.
Yes, you and then the gentleman.
Just a message from a member of the public. They'd like to know about the arrangements for separated parents for children who live between families.
We will give more detail on that tomorrow, but if anybody can remember what it was like last time, it would be the same arrangement.
Thank you. Gentleman there, you have another question.
Dr. Brink, when did contact tracing start, and should people be surprised if they see an increase in positive cases over the next few days?
So contact tracing started within an hour of getting these positive results, so it started immediately last night, and as I say, we finished at about 1 o'clock this morning, just speaking to people, but then correlating the information we had, trying to make sense of the information we had. So we carried on into the early hours of the morning doing that. I don't think we should be surprised if we see more positive cases. So I think undoubtedly we will detect some amongst those contacts, and we might detect some more in the community. Until we've done our two parts that we're going to do, which is the testing of the direct close contacts that fulfill our criteria of being a close contact, as well as our wider community testing, it's impossible for me to answer the question other than to say I wouldn't be surprised if we see some more cases.
Yes.
Yeah, if I could just add, because I've had a message since we've been on the panel, that our phone lines are being inundated, and some of those are those that have been attending the Ship and Crown and the Crow's Nest. Can I just emphasise the point made by Dr. Brink, that those of you that may have attended the Ship and Crown and Crow's Nest between the 18th and 20th of January, can you please email rather than phone at test results at gov.gg. So if you've attended the Ship and Crown between the 18th and the 20th, please email us at testresults at gov.gg. Thank you.
So that's the Ship and Crown and the Crow's Nest.
Yeah. And the Crow's Nest, both places.
Question for Deputy Breward. What does this mean now for those that are scheduled for medical appointments or medical treatment on Island?
Right, we've got some more details will come out tomorrow, but at the moment all elective surgery for Monday has been cancelled, and we'll be reviewing the situation literally as we speak. But that's the first decision that's been made.
A question from hospitality. Are hotels allowed to offer room service meals to guests who are already staying in-house?
I mean, again, if people are there already, then they have to be fed, they have to be, but because they're already, that's where they are. Presumably they're only there for a short period of time because they're hotels, but if they're there in any way, they've got to, that could clearly continue. But again, as Deputy Salisbury's made the point, Deputy Breward has also made the point that we'll have more information generally tomorrow, because we've moved with such speed. To pretend we've worked out every conceivable detail or every conceivable situation, of course, that would be unrealistic. We haven't. We think, as Mr. Whitfield said earlier, we've been on this. Dr. Brink was working on this till the early hours of the morning. I was contacted late last night. Deputy Salisbury and I had several discussions late last night. We've had meetings since 6:30, 7 o'clock this morning on this matter, and no doubt we'll have other meetings between now and 12 o'clock tomorrow. But the answer to the question is, of course, if somebody's there, they've got to be fed, they've got to eat. But again, social distancing, no contact, you leave the food outside the door, knock on the door that the food's there, exercise common sense.
I mean, lots of people in the hotels would be people who are self-isolating before they've gone and doing work. So the hotels should be geared up to knowing what they should do for somebody who's self-isolating and ensuring that they're following all those precautions.
Yes.
Are we able to say which school? You mentioned pupils in Year 8 at one of the schools.
It's St Sampson School.
Okay, thank you. So I've just had one more message come through asking, it's one of the island's rectors asking if there's a plan for funerals.
So that'll be part of what is worked out in the policy as that rolls out over the next few hours.
Yeah, I mean, last time when we did this, we stopped all social gatherings except for funerals, where we allowed just a small cohort of immediate relatives, for want of a better word, to attend, and that's likely to be very similar.
Yeah, and indeed, the point is, as Deputy Salisbury's made the point before, and I made it in my introduction, sadly this is round 2. So a lot of lessons were learnt in round 1. We're not going to try and create everything anew. If good knowledge was gained from last time, that will be implemented this time, both in relation to that item and generally. Sorry, I saw somebody's hand raised. Yours, sir.
Can you, I know we're going to find out more about schools in the coming days, but does the island have enough PPE, masks and gloves and hand sanitizer that can be rolled out in the schools effectively, if that was needed?
Again, I think an excellent question. We can answer that better tomorrow. But I think the answer is probably yes. But again, I don't want to just do things on the hoof. Let's do it when we've got evidence-based.
I can add, certainly from the point of view of the hospital, St John's and those sort of areas, no trouble at all. We are okay for all the PPE needs.
Yeah. stocks were built up over the period to
Yeah.
make sure that we were prepared. So when the situation isn't again like it was last time when PPE was hard to come by, and there was a lot of hard work getting it on Ireland.
Yes, sir.
In terms of the lifting of restrictions when they do come about, do you expect that to be a phased approach, or is it difficult to say at this stage?
What, the release you mean? Sorry.
When we come out of lockdown,
Oh yeah, it will be.
a phased
There
approach
the
and
idea,
sort of
the idea
like-
will be. There'll be at least 2 stages. Dr. Brigg, I think you could add
Yeah.
something to that.
So we will do a phased release. So we're in lockdown, and we'll have probably 2 steps after that to come out of lockdown, and we'll base the progression on the time from the last case of community seeding. So going back to the incubation period, advised 2 to 14 days. So we'll work in increments of either 7 or 14 days, counting back to the last detection of a case of community seeding. So if you recall from the first lockdown, is we weren't so worried about contacts of cases because we knew about them. They were in self-isolation. It was the community seeding that got us worried. So we'll count back to those cases. So if you recall from the last lockdown, we went into lockdown on the 25th of March, and the last case of community seeding was detected on the 5th of April. So we're sort of accounting forward. We'll try and look at that, but it's going to take some time to actually for us to ascertain that we don't have community seeding, and then we'll count forward from there, possibly through 2 steps. So we don't want to go back through 5 phases. So we want a short, sharp lockdown, and then hopefully progression out to normality as soon as possible. But I can't give you the exact timing of that until we get a better handle of what's going on.
Any other questions? Yes.
Does this now put more emphasis on the vaccine, that we need to get the community vaccinated as soon as possible?
So we're vaccinating as quickly as we can. So we could vaccinate far more. I think we discussed that with you yesterday. So we could do more than the 3,000 odd in our community vaccination centre. So we will vaccinate as quickly as we can with the vaccine that's provided to us. But yes, absolute emphasis on the importance of vaccination.
And as Dr. Brigg has made the point, it's not going to hold up. This recent series of events, unfortunate as they are, they're not going to hold up the vaccination process at all. Indeed, it makes it even more important that people are vaccinated. I think you had a question, did I?
Yes. Can you confirm if the new measures and community restrictions are a legal requirement?
What, sorry, illegal?
If they're a legal requirement?
Yeah, they will be legal requirements.
Yes.
Yeah, of course. They will be. They're enforceable. They will be. Regulations being drafted as we speak. They will be. Heidi, do you want to add anything?
No, I mean, absolutely. But I think we found the community, they certainly from last time, the community worked with us, and what we said we needed to do, even then saying whether it needed to be in regulation or not, people listened and supported what we did, and so things worked, and we got out of lockdown, and things worked. So, but yes, we are backing it up with regulation.
As Paul has already said, people are exercising considerable common sense and restraint already in the few hours. I mean, driving from where I had to come here, there's hardly any traffic on the road. This is a Saturday. The roads would normally be busy. People are already doing the sensible thing. Any other questions? Yes, sir, and then you. Yep.
We have seen this morning, though, people dashing to the shops. Are you concerned that people did panic this morning, and what would be your message to them?
Merits too?
Well, people were sort of dashing to the shops once they realised that there may well be restrictions. Were you concerned about that people are panicking a little bit?
The people don't need to at all. We haven't got any restriction supply. Food and essentials are coming through, so there's absolutely no need to. Yeah. And so that's the assurance we need to give to the public.
Yeah. And people should exercise their common sense and their restraint. They should go and do their normal shopping for foodstuffs, etc., essential supplies, as they would do last week, as they do the week before. I think I saw your hand raising.
Yeah, just a question about clinics or any medical areas who might have physiotherapists or occupational therapists, but they might be seeking urgent people, people who might be post-surgery, that kind of like, it's obviously not your general day-to-day appointments.
Dr. Brigg.
So all of the rehab post-surgery and so on, last time our medical director, Dr. Peter Raby, developed protocols for the management of people under those circumstances. Now, clearly, we don't want any urgent care to be delayed. We don't want to impact on people's physical well-being if it is urgent. So any urgent care, the plan would be to work out how that can be administered. And Dr. Raby will be looking at that as part of the medical response to what's happening.
And these surgeries can speak to Dr. Raby directly, can they?
Yeah, the best thing would be to speak to Dr. Raby and talk about what management the person needs. Yeah.
If I could just add to that as well. Please, the hospital is open, and if you do have an emergency, whether it's a car accident or something else, please do use the emergency services. But there will be more protocols, and there'll be people wearing PPE, and we'll just be taking that extra care. But if someone does have an emergency, the hospital is still open and it's still operating, and from that point of view.
Just for clarity, can you confirm that co-funding guidance will be issued tomorrow, just for businesses?
Not necessarily tomorrow, as soon as is practical. The point is that we're doing this at speed, but we can't do everything in 5 minutes or even 24 hours. We anticipate there'll be regular communications on a variety of topics over a period of time. The intent, as I said earlier, and as indeed has been made clear by my colleagues on this panel, is that we will give information as fast as we can, as accurately as we can. But I don't think I can say that something will be announced necessarily tomorrow.
I mean, we're looking at what's a priority. The priority at the moment is the health of our community, making sure we're on top of the virus, and then other things will follow. So we can't guarantee tomorrow. It probably won't be tomorrow, because I think questions for a lot of the community of what it means to them, lockdown, what they can and can't do.
Yes, sir.
We went into lockdown around 10 months ago for the first time. What are the main differences this time?
Well, we've learnt more lessons, as I said to one of your colleagues, I think. We've learnt lessons, so we're not going to repeat everything, in the sense we don't have to relearn everything, but so there'll be changes from last time because we've learned to do things better and we're more informed. But hopefully we'll come out of this as quickly as we reasonably can. Dr. Brigg.
Yeah. So I think there are some fundamental differences. First of all, we understand more about COVID-19 as disease, and we understand more about how to manage it. So we understand more about the optimal management. So that's important. So anyone who becomes really unwell, for example, we understand the role of oxygen therapy and the use of dexamethasone, just for example. The second is we have a very well-established testing system. So if you recall, we went into lockdown on the 25th of March. Our on-island testing availability came on the 28th of March. We then were able to test up to a couple of hundred samples a day. But we're now able to test up to over 1,000 samples a day. So we have a greatly enhanced testing capacity. So if you recall what I said about how we're going to manage the cases, not only the very focused contact tracing testing, which we were doing in the first wave of the pandemic, but some broader, more population-based testing so we can get a better handle of what's going on. So I think the testing capacity. We've also learned with regard to contact tracing. So in the first wave of the pandemic, we went back for 24 hours prior to people becoming symptomatic. We've reviewed a lot of the published data that's come out, and we now go back 48 hours. So you put that extra level of comfort on. The role of pre-symptomatic transmission, so people transmitting the infection before they become symptomatic, has also become apparent, and that's a really important. In fact, it's more important than asymptomatic transmission, that pre-symptomatic transmission. I think the unknown we're facing on this occasion is the emergence of the viral variants and exactly what that impact is going to be. And that was also key to our decision making. Not only did we have these 4 cases, but we are sitting against the background of a changing situation. And it was that uncertainty that we've always done what we can to try and protect the health and well-being of the population. And I think that reflects that.
I think also, if I can add to that, is that the hospital is also better prepared now. We've got some idea of what to expect. We've got more ventilators, there's more oxygen available, and there's been more work done on protocols and how to manage. We've got a Brock ward which we can open up within an hour if we need to, if we do unfortunately get any cases that need more serious treatment.
Yes.
And can I just clarify the arrangements for exercise? I know you said it's up to 2 hours outside, but
Yep.
Can people do it socially distanced? I know last time we talked about socially distanced sea swimming or socially distanced cycling or running?
Yeah.
What will be the arrangement this time?
It'll be, I'm sure it'll be exactly the same. Those are the details we're going to give you tomorrow. I think if people can work on the basis, it will be as it was at the very beginning last time, and be cautious. And that's what we were always telling people. And I remember back at that time, and people said, what about this and what about that? I say, please use common sense. Just think about why we're making these restrictions. It's stop the spread of the virus, ultimately. So what you do, just make sure that you social distance, hand hygiene, everything like that. All that we've done before. We've been there, we've done it. We know we can do it again.
The 3 words: be cautious or cautious, and use your common sense. So cautious and common sense are the guiding words. Yeah.
You mentioned encouraging people to wear face masks. Is that both when they're indoors and outdoors, for example, when they're in supermarkets or when they're going for a walk? And when it comes to face masks, are you looking at medical face masks, or can it just be like a scarf wrapped around the face? What sort of thing do you envisage or would you like to see?
So we're looking at face coverings. So it could be anything covering your face. The main thing is you've got to think of how SARS-CoV-2, the virus that causes COVID-19, transmits. So it transmits in closed areas where you have people sitting together in close proximity. So hence all of us sitting today with our face masks on. We're in a closed room, and although we're not 2 meters apart from each other, it is a closed area. So it is predominantly for indoor, particularly when you are with a group of individuals that you don't mix with normally in your household. So that's really important. Outside the household, it's going to shops. So if you're doing your essential shopping, is wear a face mask when you go do your essential shopping. Really important as well. So it's that type of thing. So if you're exercising outside, if you're socially distanced away from everyone, then that's reasonable. But most of the time we will say if you're out of your house is try and wear a mask. And we haven't made it mandatory, we've made it strongly recommended. And again, what I'd be saying to Islanders, just think, we've got our, as Deputy February said, our common sense and our logic has got us through so much. And I think that common sense and logic needs to prevail. And that's why we've chosen not to mandate, but to actually make it strongly recommended.
Any other questions? Don't see any hands raised. No, I don't think I see any hands raised. So I thank the press for what I thought was really able, precise, and far-reaching questions, constructive, and hopefully as I say, the intent from us as a group, individually and collectively, is to give as much information as we can, as quickly as we can. We're very sorry we're here, but again, in relation to one of the questions one of your colleagues, one of the member of the media asked, there's no need to panic. This is a situation that is under control, and it's a situation that we'll get through. But we want to get through it as quickly as we can, as sensibly as we can. We ask everybody for their cooperation, which they've given, and we'll see the media again tomorrow. Thank you very much.